With the winter season now in full swing, residents in the Southeast can look forward to a lot of this. And even more of this. Dr. Denis Fortier, Vice President of Medical Services with Southern Health-Sante Sud, says that people should use common sense if they're undertaking the physical exertion that comes along with clearing the driveway and sidewalks.
Anytime that we do anything that requires more energy is pretty much the time where you're more at risk of developing a heart attack. And this is mainly in people who are at risk to begin with of having heart attacks. So I'm talking about the elderly, people with diabetes, pre-existing heart disease or hypertension, strong family history, those people in general. Anytime you're asking your heart to work harder for whatever reason, puts you at risk for a potential heart attack.
Studies have shown that there are significantly more heart attacks in winter than in summer. And it's not just the physical exertion associated with shoveling snow that's to blame. Research has proven that your risk for heart attack increases with the colder temperatures that occur during the winter months.
When you're talking about drops in temperature, what you're really talking about is an increased demand of energy for your body. I mean, you're working harder to stay warm, for instance. And so I can certainly see that increased demand for energy, which is translated to an increased heart rate, more work of the heart, that can certainly predispose you to having a heart attack, especially if you had one before.
Aside from the increased demand for energy to stay warm, another risk factor when it comes to colder temperatures has to do with what's in your bloodstream.
Without going into too much detail, there are certain proteins that float around in our body. They're inflammatory proteins, if you will. These proteins cause inflammation of the lining of the arteries, which then cause platelets to aggregate or build up in areas where there's a bit of an obstruction, and that's really what causes your heart attack.
If you want to decrease your risk for heart attack, you may also want to consider the time of day you decide to shovel your driveway.
There are times in the day where we know that our body demands more energy. For instance, waking up in the morning. So more people are having heart attacks as they wake up in the morning because your body is suddenly asking for more energy as the turbines start, working again. Eating actually demands quite a bit of energy. So digesting the food that we eat, the bigger the meal, the more energy is required. So that is certainly a time where people will develop angina or chest pain, certainly those people who have heart disease. So imagine, going outside where it's cold. That's an increased demand for energy. After a meal, that's increased demand for energy. And now you're actually doing physical exercise, which maybe you're not familiar with, your body's not familiar with, i.e. shoveling snow. That puts you at quite an increased risk for a heart attack.
Dr. Fortier offers some simple advice for those most at risk of any ill effects due to the strenuous physical exertion that comes along with clearing snow.
Probably the safest thing for someone who has a pre-existing heart condition is to ask a neighbor, a friend, or family to do your shoveling for you. Because it is quite labor intensive, takes a lot of energy. We have no gauge of knowing how much is too much. So I think in those cases you might want to consider asking a friend. For the rest of us, I think you want to not do this type of strenuous activity after eating, for instance. You certainly want to be dressing up warm so that your body's not also trying to stay warm. And it's a bit like, how do you eat an elephant? One piece at a time, one bite at a time. I think with shoveling snow, those big snow banks, you don't want to do it all at once. You want to do small pieces at a time. You want to pace yourself. You want to take breaks. And by all means, if you're getting a little short of breath or if you're having any sort of discomfort, you really need to take breaks. And today we talked about heart disease. Tomorrow we could be talking about back pain as it relates to shoveling snow. I mean, there's a whole bunch of other reasons why we need to be pacing ourselves when we're doing strenuous activity in the wintertime.
For Steinbach Online, I'm Karen Black.